Welcome to the deep dive. You know that feeling, walking out of a doctor's visit and thinking, wait, what did they actually say?
Oh, yeah, like you were nodding along, but it didn't quite sink in.
Exactly. So today, we're tackling just that. How to handle those healthcare conversations more confidently. Really get clarity.
It's for anyone who wants to be well-informed about their health, not, snowed under by technical terms.
Because healthcare really should be a partnership, a two-way street.
Absolutely. And to help with that, we've pulled together insights from, well, quite a few places. We looked at standards from Joint Commission International, JCI, and India's NABH.
Right, the big accrediting bodies.
Yeah, and also practical advice from healthcare consultancies like Supreme Medic, plus tips from patient advocacy groups.
So, our mission for this deep dive is pretty clear. To give you actionable ways to ask questions confidently and, crucially, understand the answers about your health.
Okay, let's get into it.
First things first. It sounds basic, but your health is your health, right? It's your responsibility.
It really is. And understanding your condition, your treatment options, that's fundamental to making good decisions for yourself. Supreme Medic's Lifelines podcast touches on this a lot.
It does. And think about a typical appointment. There's so much information flying around.
It's so easy to miss things or just get lost in the terminology.
So being an active participant, asking those questions like lifelines, suggests it's not just helpful, it's vital.
And it directly prevents miscommunication. That's a key takeaway.
How so?
Well, when you ask clarifying questions, you make sure you and your doctor are actually on the same page about the diagnosis, the treatment plan, everything.
Right, no crossed wires.
Exactly. And that alignment is something JCI standards really emphasize for patient safety, too. It's critical.
Which is interesting because we know many patients, particularly here in India, often leave feeling, well, confused.
Yeah, there are lots of reasons for that, aren't there? Feeling rushed.
Or just hesitant to speak up, maybe not wanting to bother the doctor.
Or sometimes, honestly, just not knowing what to ask. That's a big one.
Okay, so that leads us to the how. How do we get past that hesitation, that uncertainty?
Well, a really crucial first step, something that comes up again and again in our sources, including Lifelines, is preparation before the appointment.
Preparation. Sounds simple, but maybe not always easy to do.
It doesn't have to be complicated. Just taking a few minutes beforehand can make a huge difference.
So what does that look like, practically speaking?
Our sources suggest writing things down, your symptoms, of course, but also when they started.
Okay, symptoms, timeline.
Any medicines you're currently taking, super important. Past illnesses, any allergies you have.
Got it. Like a little health summary?
Exactly. And maybe jot down, say, 3 or 4 key questions, the main things you really want to understand by the end of the visit.
You just use your phone's notes app or a small notebook.
Yeah, whatever works for you. Something easy to glance at during the appointment. Keeps you on track.
And what about if you're seeing a specialist or getting a second opinion? Lifelines mention something about that.
Right. In those cases, having really specific questions ready that address your main worries or the reason you're seeking that specialized care, that's even more important. Helps focus the discussion.
Makes sense. Okay, so you're prepped. Now you're actually in the room. What do you say? How do you ask?
Yeah, the phrasing matters. You want to be respectful but direct. Our sources had some good examples.
Like what?
Things like, "Doctor, could you please explain that again in simple words?" Very straightforward.
Okay, that's good. Takes the pressure off knowing all the terms.
Or, "Can you tell me the next steps clearly so I don't miss anything?" Puts the onus on clarity.
I like that. What else?
Maybe asking about the severity. Is this condition serious? Or is it something that can be managed? Helps gauge the situation.
And thinking ahead, should I bring someone with me for the next visit? That's a practical one.
Definitely. And another technique our sources highlighted is using open-ended questions.
You mean questions that don't just get a yes or no answer?
Exactly. Starting with what, how, why, when, where, or who, they encourage the doctor to give you more detail, a fuller picture.
Instead of just, is this serious? Yes. End of story.
Right. You want the explanation. And how you ask matters too, using neutral, non-judgmental language.
Why is that important?
It just fosters a better dialogue, makes it easier for everyone to communicate openly and honestly. Less defensive, maybe.
Okay, so let's talk specifics. What are some good general questions people could have ready?
Well, the absolute basics, like what exactly is wrong with me or what's going on with my health.
And is this condition temporary or is it long-term? Understanding the timeline.
Crucial. Then about treatments. What are the side effects of these medicines? That's a must ask.
Yeah, definitely. And what are my treatment options? Plural. Are there choices?
Good point. Also about tests. Do I need any tests and why? Understanding the purpose.
Right, not just blindly agreeing to tests. What about recovery?
Asking things like, how long before I start feeling better, helps set expectations.
Or, what should I avoid while recovering? Activities, foods, that sort of thing.
And the logistics. When should I come back for a follow-up?
Okay. What about understanding results or more complex stuff?
Definitely asking, could you explain this test result in simpler terms? Don't be afraid to ask that.
And if treatment is proposed, asking, what are the potential risks associated with this treatment?
Super important. Also, specifically for medicines, what should I do if I experience side effects from the medication, knowing the plan B?
And how soon should I start seeing improvements? Again, managing expectations.
You might also ask, are there other treatment options I should consider? Just exploring all avenues.
Especially if something like surgery is suggested.
Absolutely. Is surgery the only option, or are there less invasive methods? That's a key question.
Along with, what are the risks associated with this procedure, specifically?
Yes, and looping back to meds. How do I manage potential side effects from this medication? Getting practical advice.
And finally, confirming the next steps clearly. When should I come back for a follow-up visit?
Or, are there any tests I need to schedule after today's appointment? Just tying up loose ends.
It seems like a lot of questions, but
But remember what our sources said. Doctors generally appreciate honest questions. They really do.
right. It helps them avoid mistakes and improves your care overall. It's not about being difficult.
Not at all. It's about being involved.
Okay, so asking is one part. The other part is listening, right? Really taking in the answers.
Absolutely. Active listening is key. Our sources emphasize paying close attention to the explanations.
And taking notes. You mentioned that earlier for prep, but during the consultation too.
Yes, definitely. It really helps cement the information. It seems small, but it's effective.
And what about checking your understanding?
That's a great technique. Try paraphrasing what the doctor said back to them.
How would you do that?
Something simple like, okay, so if I'm understanding correctly, you're saying, or just to check, I've got this right. It confirms you're on the same page.
And if you're not on the same page, if it's still fuzzy,
Don't hesitate. Ask again. Seriously, all our sources agree. It's okay to say, I'm sorry, I'm still not quite clear on that point. Could you explain it maybe differently?
no shame in asking for clarity.
None at all. And Lifelines had that great tip.
Yeah.
Don't be afraid to ask for simpler language.
Right. If a term is confusing, just say, what does that word mean?
Or, could you break that down for me? Or, can you give me an example? Whatever helps it click for you.
Now, sometimes these situations can feel a bit much,
Yeah,
overwhelming even,
they definitely can. And that's where support comes in.
bringing someone with you.
Exactly. Our sources, including Lifelines again, suggest bringing a family member or a trusted friend, especially for complex issues or big decisions.
How can they help best?
Well, they can be another set of ears, first off, help listen.
Take notes, maybe.
Yes, take notes for you. And they can also help ask questions, maybe ones you forget in the moment or feel a bit shy about asking yourself.
That makes sense. But what about those feelings, the reasons people hesitate? Lifelines mention some common ones.
Yeah, like worrying about wasting the doctor's time. That's a big one.
But we've established good doctors actually want you to understand.
Right. Exactly. Engagement is good. They want you to get it right for your own safety and health.
Okay, what else? Feeling like you'll seem uninformed?
Mm-hmm. But let's be real. Nobody expects you to be a medical expert. Asking questions shows you care and you're trying to understand. It's a positive, not a negative.
Am feeling embarrassed? Maybe about asking something personal or seemingly silly.
Doctors have heard it all, truly. Our sources reassure us on that. No question is silly if the answer helps you feel more comfortable or clear about your health.
So if you do bring someone, a family member or friend, is there advice for them?
Yes, our background material had some good points. Firstly, let the patient speak first. It's their appointment.
Right. Don't take over.
Don't take over, support, don't dominate. Taking notes is great. Asking clarifying questions after the patient has spoken is helpful.
Avoid interrupting the main flow.
Yeah, try not to interrupt too much. And maybe help confirm the follow-up plan at the end. Make sure those details are clear.
Okay, so the appointment's done.
Yeah.
You've asked questions, hopefully gotten clarity.
Mm-hmm.
What happens after you walk out?
Good question. Don't just file it away. Our sources say review any notes you took pretty soon after.
While it's fresh in your mind.
Exactly. Helps it stick. And if you get home and realize you're unsure about something, like the medication dosage,
Well, then
Don't guess. Our sources suggest calling the clinic or the pharmacy. Double check. Better safe than sorry.
Definitely.
Yeah.
And then, it sounds obvious, but
Follow the instructions. Yes, crucial. Whether it's for tests, taking meds correctly, scheduling that follow-up, it's all part of the plan.
can't skip that part.
No. And one last practical tip from our material. If a question pops up later, maybe a day or two after, most clinics or hospitals have a helpline or a number you can call for non-emergency questions. Don't hesitate to use it if something's unclear.
That's really useful to know. Okay, so wrapping this up.
Let's bring it back to you, the listener.
Yeah. The key takeaway has to be, you are the main stakeholder, the most important person in your own healthcare.
Absolutely. And remember, asking questions isn't being difficult. Our sources frame it as being responsible.
Right. It's about taking ownership, participating actively.
Making sure you have what you need to make the best choices for your own health and well-being.
So here's something to think about. We know organizations like JCI and NABH work hard setting standards for quality and safety in healthcare here and globally. That's vital.
The system side.
Right. But the other pillar, maybe just as important for truly effective healthcare, is your active participation, your informed questioning.
It really is fundamental.
So the question we leave you with is this. Thinking about your next healthcare interaction, what questions will you prepare? What will you ask?